Thank you for the introduction and the invitation to speak here today about our facial health recognition AI technologies. So one of the fundamental problems in medicine is that doctors are making decisions based on chronological age. That's the age based on your date of birth. We will put this number into decision support tools, risk calculators, to guide how to select a treatment or guide prognosis. But we all know that people age at different rates due to lifestyle, environment, and genetics, such that doctors will try to qualitatively assess a patient's biological age, which is a measure of their physiological or functional status, to help personalize care, such that if we encounter a patient that's much older biologically than their chronological age, we might need to de-intensify treatment for that patient or give them more supportive care to get through a tough treatment like chemotherapy for a cancer patient. Conversely, we also see patients that are older based on their date of birth, but are much younger biologically, 20 to 30 years younger. And that's someone we want to treat more aggressively, offer them the treatment that a younger individual would deserve. So if we rely just on chronological age without factoring in biological age, we might make the wrong decisions, which can lead to patient harm. So we all know that in everyday life, we make subjective assessments of a person's health just based on their appearance. Doctors do the exact same thing. You'll hear us use phrases in the clinic like the patient looks older than stated age, or the patient doesn't pass the eyeball test, as we try to qualitatively assess and try to personalize care based on somebody's health status. Our central research thesis is that a face photograph can capture the health status of a patient, and that we can use AI technologies to transform these subjective assessments into quantitative and actionable biomarkers. We've developed multiple facial health recognition AI technologies now, including a foundation model trained on 40 million face photographs. This model uses self-supervised learning, which is a method where the AI learns on its own the important quantitative features across this diverse set of faces. It doesn't perform a specific task, but then we can use the embedded knowledge in this model to train additional algorithms. Our first algorithm is something called FaceAge, which takes a simple face photograph, analyzes it, and predicts an age, a biological age. Using the foundation model, we're able to show that our FaceAge algorithm is superior in performance at age estimation compared to other state-of-the-art technologies. But the real advantage of the foundation model is it allows us to unlock healthcare data, which is a relatively more scarce data sets. We were able to use the foundation model to train an algorithm that we call face survival, which is trained directly on 30,000 cancer patient photographs and their known outcomes. This algorithm will predict directly a clinical endpoint, which is cancer mortality. We have now clinically validated both these technologies across multi-institutional data sets of over 40,000 patients, showing that they're independent prognostic factors in cancer care. We think these technologies are state-of-the-art, scalable, and very adaptable in the sense that we can use the foundation model to build additional algorithms tailored to new clinical outcomes or indications. We have provisional patents in place across all these technologies, and let's dive a little bit deeper into one of our algorithms to look at how we might apply it in the clinic. So FaceAge takes in as input a simple face photograph. It localizes the face, extracts quantitative features, and predicts a biological age, what we call FaceAge. So in this example, the patient's face age is much younger than their chronological age. So we took this algorithm and applied it across thousands of cancer patients' photographs. And what we observed is that cancer patients on average look about 5 years older than their chronological age. In comparison, when we looked at healthy controls, people without cancer, their face age minus chronological age difference centered at 0, so they're more age congruent. Interestingly, when we looked at lifestyle factors like smoking and drinking, these things also raised people's face age relative to their chronological age. Most importantly, when we looked at face age in our large cancer cohorts, we were able to identify that it's an independent prognostic factor of survival in these patients, even after adjusting for chronological age and other key clinical factors. In this survival plot here, you can see that individuals or patients with a face age older than 85 had the worst survival outcomes, with very few long-term survivors compared to individuals with a younger face age. And so we then wanted to test a clinical use case for FaceAge, and we looked at one of the most difficult situations of prognostication in medicine, which is figuring out a prognostication at the end of life. And so one of the classic questions that doctors ask in this context is, do you think this patient will die within the next 6 months? So we conducted an experiment where we asked 8 oncologists the 6-month question in 3 phases. In the first phase, we gave them the pictures, just a picture, of 100 cancer patients and asked them the 6-month question. Not surprisingly, with just a photograph, doctors weren't very good at prognosticating end of life, and their accuracy was only slightly better than a coin flip. We gave them some clinical information along with the picture. Their performance improved a little bit, but when we gave them FaceAge, their performance at prognosticating improved significantly. So this experiment illustrates how we can integrate AI into the clinic to improve clinical intuition of our clinicians and to improve their decision-making at the end of life. But we really think this technology has broad implications across all of medicine. Anywhere we use chronological age in our decisions, we think that FaceAge can provide additional support. So you can imagine in the near future in a clinic, a patient checks in, a medical assistant takes their vital signs, snaps a face photograph, and our algorithms run automatically in the background, calculate a FaceAge, and that gets integrated into the existing decision support tools, replacing chronological age, allowing the doctor to personalize care based on the individual's biological age. But the real advantage of our technology is we don't have to think just about the clinic. Anybody with a smartphone with a camera, any digital camera, can take selfies of themselves longitudinally over time and get healthcare data. So we think of this as a completely novel vital sign that's easily accessible, low cost, and can be taken over a lifespan. So we think our technology has significant value proposition to healthcare providers and payers. Some initial target markets we think are in the population health space, where FaceAge and our technologies can help with guiding life expectancy, assessing chronic disease risk. As patients transition into the medical system, we can support chronic disease management through selecting the right treatment and predicting risk for complications. And I've already shown you the value of our technology in end-of-life prognostication. Our technologies have significant competitive advantages too. They're highly scalable because they're trained on consumer-grade photographs. Any photograph will work. They're robust. They've been tested against varying conditions like skin tone, lighting, plastic surgery, and most importantly, they're clinically validated. They've been developed with clinical data and are adaptable to new clinical indications and outcomes. So in summary, we've developed groundbreaking technology that turns a selfie into a clinically validated biomarker. We have provisional patents in place, and we're looking for partners to join us in revolutionizing how the world measures health and aging. And we're looking for funds to start a new code to drive product development, initiate clinical trials, and launch some of our early go-to-market initiatives. Thank you for your attention.